Well, hello, everybody, and welcome to this episode of the podcast show. My very special guest today is Dr. Matthew Malonis. Welcome, Dr. Matthew.
Hey, I'm super happy to be here, Dr. Wayne. I know it's bright and early for you doing this, but we'll give you the best we can.
Excellent. So we have a little friend.
We do.
On the podcast show today. What's his name?
We do. We've got our Great Pyrenees, Elliot, who won't leave me alone. But at least he's the only one. There's another big one, but hopefully he's sleeping still.
Excellent. So Dr. Matt is a chiropractor who has his own practice in Illinois. So he's in the field of helping people heal from chronic pain. So first, Matt, let's have a conversation about what brought you to this point of helping and serving your fellow man in Illinois with back pain and lots of different types of pain within your career.
Yeah. So my story goes back to childhood, and I was just one of those very active kids who was always seemed to get hurt in sports. And so one of our best friends' dads was an orthopedic surgeon who actually got to the point where he made a deal with my dad that he would only take our insurance money and not worry about the copay because we were there so often. As a family. But I really kind of fell in love with medicine growing up, being that I had multiple broken bones and other issues. And so my path was always to be a doctor. I've always knew from a young age that I wanted to go into the healing arts and help people just the way it had helped me. When I was a sophomore in college at University of Illinois, I had a random knee twist while running. I mean, it was just one of those freak things where you step off the track a little bit and you get that little pop and a little twist, and what should have probably got better in a couple of days didn't get better. And it led me to about a year and a half of some nasty pain, where one knee became both knees, became back problems, became fighting pain from failed surgery, failed medications, failed therapies. And nobody really had an answer for me. I did everything I could. I mean, my parents spared no expense and took me to whoever they could. And really, I remember like just not wanting to really live anymore, because here you are at 20-year-old kid and you're wheelchair bound almost, and you can't go to class in college, and the pain is excruciating. You don't know what to do. And the best of the best have given their opinions. And it's just one of these freak things. And actually, what was really funny is coming home for Christmas break my junior year, my dad says, when you're home, we're going to go to the chiropractor. And I know chiropractors hate my story, but I always say, Dad, I'm pretty sure I don't want to go to the doctor whose office is next to the discount tobacco store in the strip mall. And so, I always laugh about that to that day. But if we tend to have our offices right next to, whatever store is out there. So that was my only thought. I didn't know anything else. And I went in there, and the man literally changed my life, because he had this conversation that talked to me about the brain and the connection through the spinal cord and the nerve tissue to the body, and the need for it to be functioning and healing correctly to even allow other things to work correctly. And that never even occurred to me, yet the philosophy of chiropractic is just above, down, inside out, brain, spinal cord, nerves, and allowing that to heal. And so I didn't have any other choice. I was home for break, started working on me. And after several months, not only did pain go away, but even the residual things like chronic bladder infections from the medicines I was taking, all these things all began to heal. And he asked me one day what I want to do for a living. And I said, well, I really kind of want to be a surgeon. And the look on his face was a little disappointed, not because he didn't know, we need fantastic surgeons, of course. But, he was kind of under this impression that my life had now changed. So I actually looked into chiropractic school and I fell in love with it. And that was just my future. And so I've really just spent the last 20 years trying to give my all to the community, not in a way that doesn't include everybody in all healing arts, but in a way that tries to figure out how chiropractic can play a role in people's health within what we're doing in the medical just world in general. And that would be the end of my story, except for in 2015 on a Saturday morning, January 10th, after being in practice for 15 years, loving it, great family, amazing wife. By the way, I married a chiropractor because my mom said I was so crazy. about healing and my views on natural healing that I had to marry a chiropractor. So I did. She's my bride, the love of my life, probably the best decision I made in my life. But in 2015, on a Saturday morning, I woke up and I think, oh, here's the other dog, by the way, Dr. Wayne. I mean, people can't see him, but this is the Newfoundland. That's right. That's right. We got all spectrums. There are babies. We love them. I can't describe the pain other than just to say these words. The pain was the worst thing I've ever felt in my entire life. And yet I felt like my left leg was not part of my body. People who've been there know what that feels like. People who have not been there don't really understand that feeling of how can something that doesn't feel like it's a part of me hurt the way it hurts. And that was Saturday, January 10th of 2015. And I didn't realize that I'd probably spend the next 4 to 5 months on my back. That injury took most of our business. As most people in chronic pain know, it shakes up relationships and marriages, finances. To have little tiny children who say, "Daddy, pick me up," and you can't stand, much less want to pick them up. And so I still get emotional thinking about that. But that 4 or 5 months probably changed my life for the rest of my life, because even as a chiropractor who had dealt with people, I don't know that I'd ever identified with anybody at that level of pain before. I don't know that I had empathy in the way that I needed to have empathy. I don't know that I had understanding when they would walk into my office, but here I was, and now I had it. And I spent the first month being a trooper, just sucking it up. I'm going to avoid medicine. I'm just going to suck it up. I'm sure my body's healing. I wasn't quite sure what it was. I had done the research, talked to people. Could it be piriformis disc? I was too proud to go get an MRI. And finally, the end of January, I did. And at L5S1, I was actually in the MRI machine when the tech came in and said, yeah, we're going to do a contrast because the radiologist took a look at the first pictures and thinks you have a large spinal cord tumor. So what went from waking up one morning in massive pain now became, wait a minute, could this be cancer? Of course, the contrast MRI came back and showed no signs of life. And so what we, obviously learned later was that I had sequestered L5S1. And it had shattered, and it had the fragments had fallen down and wrapped themselves around the S1 and S2 nerves as they exit the sacrum. And obviously, then everything where those nerves go to was up in arms. Luckily, I didn't lose any bladder function or bowel function, but it changed my life for the rest of my life. And then, so I spent 4 or 5 months just trying to recover from that, learning what I could. And I think what spoke the most life into me was in April of that year, I went and actually had a surgical consultation. And it's not the route I wanted, but I watched as life was falling apart. And the surgeon was like 32 years old, and he was the head of the University of Chicago spinal surgery, and just a young guy, and conservative and just funny. And he looked at me and he said, "Do you feel better today than you did when it hurt in January?" And I said, "I do. I'm starting to, feel a little bit better." And this was from all the things I had been doing that I now teach. And he looked at me and he said, "Well, then suck it up, Buttercup." And that's literally the words that this man used. I would tell you his name, but I can't pronounce it. I just call him Dr. Chris. "Suck it up, Buttercup. You're going to hurt. Stop being a wimp. You have a severe trauma in your back. There's not much any of us can do about it. Meds are not going to really touch it. Surgery is not going to be the answer for you. You need 2 more months. We get to that 6-month time frame and your life will be different." And I remember walking out with this piece, and he was to the day, Dr. Wayne, almost to the day at 6 months, where my life and my pain went away. My life came back to me. And from then I've just been researching 4 or 5 years, working with patients, reading, doing everything I can to create what I wanted to be the most comprehensive, natural, holistic, one-stop shop for people to have answers. Because you know what, that 6 months sucks, or a year, or whatever it is. I know you see people all the time, and it's like, hey, I can do this for you, but the truth is it's just going to be time in this case. And what I've created with Pain Sucks, which maybe this is the purpose God had intended for me this whole time, was this place where people can get 1,001 things to do while they're waiting it out. What kind of things can I do to handle inflammation, micromotion, work on my chronic pain, my mindset. Where is this thing where I don't have to spend this ridiculous amount of pain I'm in YouTubing and Googling how to get better? And that's been my journey, man. So here I am, about 21 years almost since I've had my degree. And so now we've turned into this. Well, we do have our clinic still, and we still deal with a lot of people, and we love it. But I think life seems to be transitioning to more of this online coaching and helping people through my story, and then what we've created with Pain Sucks. So sorry, I talk a lot. There you go. That's my answer. I'm sticking to it.
No, I love it. I love it. And just, what rung true for me was, you're a great guy. You're doing a great job for 15 years. And then all of a sudden, everything fell apart. And
right.
Literally everything.
Yeah.
And it just brought you to your knees, literally, and to your back and to your bed. And it just started this inner journey, like a existential crisis that, opened up your life in a new direction. And I'm sure you're doing different things now, thinking things differently now. You're studying different things now, and maybe crossover from what you were doing before, but into a whole new domain of that question. Well, how do you heal? Right? Because I'm sure you believe, as I believe, that the body heals.
Yeah.
The body does heal. It's just, well, what do we need to do to help people walk that path? And, it's fascinating because I think now, these days, the evidence is there. The science is there. The research is there that healing happens. And I love the work of Joe Dispenza, a fellow chiropractor who had a similar story to you, broke his back, went through that. You probably know Joe's story. And he's gone on to do these amazing research studies with people in workshops and healing and watching transformation. And I think, the core message today is it's in us. Right? We need guidance. We need a mentor. We need, like the old Yoda, Yoda in our life, who knows the force, who knows the way, and just guides with compassion and love and insight, and knowledge. And I love the work of your podcast show, Pain Sucks. I listened to a couple of episodes, and I must commend you for your introduction. It's way better than mine. Because it's real. It's those amazing people. And
well, one of the things that happens when you have an injury like that is it's funny how life changes because people leave you, and you hate to, you're not a Debbie Downer, but when what you're going through, people can't identify. All you really have left in that moment sometimes when you're hurting is family. And to be honest, you're just your immediate family, because even others, they're not so much interested in your attitude. You're a pain to be around, because you don't know what else to do but complain and bitch and moan. And so I had my family, and I realized as I was coming out of this, the things I love the most and the best decision I made, and the thing that I love being as the CEO of this family. And so I said, how can the girls participate? They watched me go through this. And so you're right, man. We had them intro and outro the podcast, and it's a lot of fun. That's the thing that people remember the most. So I love that.
So let's talk about family, because I think unless we're rooted in a core family, and it could be friends, you could even go outside that to our community and culture. But how do you feel that role, we should be looking at that? How can we use our dear loved ones to really help us on the journey of pain?
Yeah, so I think that one of the things that I've discovered over the last 5 years working with people in this horrific pain is when we're in that level of pain, we don't see outside of ourselves. So I'm sorry, I would love to believe that the majority of us can go through these challenges with nothing but a positive outlook every day. There are some people that I meet who are the happiest people, even though their pain is a 15 out of a 10 on a pain scale. But the majority of us, we come inside first, right? We're searching inside first. Why me? Why this? It's all that victim mentality. I did it. I always tell people, I am not a Navy SEAL for a reason, right? I didn't have that mental fortitude. I did go inside and complain and bitch and moan and scream to God a lot. And I wrote about that in the book that's coming out here probably next week, is just this need. But what happens is we can't see outside of ourselves when we're on this pain. We think everything is against us. We think everybody's against us. We don't realize that our tone of voice sounds harsh to our children or our spouses. We don't see these things. So you asked me what role family plays. Well, I actually have spouses come with the patients a lot. And my answer to them is, number one, the best thing you could do is don't talk to them about their problem. Science is very, very clear that people heal faster when we're not asking them, how are you doing, all the time. I think that how are you doing questions should be limited to the physicians in their life. How are you doing takes chronic pain people into an emotional center in their brain that is linked with emotion and not anymore linked to physical problem. And so what we're doing by asking people, how you doing? I'm praying for your healing. That's all great. We think we're doing the right thing by having those conversations, but what we're doing is strengthening a pathway in the brain through the central nervous system that is actually making that person worse and taking longer to heal. Now, from the standpoint of family, the people who are not the ones in pain, who are just loving and supporting the person, do it through service, right? Do it through service. Don't ask, just see the need. You know what they need. So if it's getting a kid from school or making a meal, or you see these things, do it with a grateful heart. I have a wife who picked up with 2 young kids, one in kindergarten and one in preschool, and went from mother to full-time chiropractor, full-time mother, full-time nurse, full-time healing. She did everything with a grateful heart. And I used to lay there in bed and be like, how come she never asks me how I'm doing? And I don't know that she even knew it, but innately she knew that I was going to get better if she just served in the way she could serve and didn't bother me with constantly asking me what's up. Now, don't get me wrong. She asked me here and there, but it wasn't sympathy. I don't know that it was even empathy. And I give her all the credit in the world, because I know I got better because she wasn't there to pander to me and to my emotions. And chronic people are emotional. I was just on Facebook this morning dealing with on a Facebook page, and it's amazing to me. I remember the depression and the suicidal type of thinking that people in chronic pain go through. That's number one. Those of us in pain who have family around, it's hard to do anything except for think about ourselves in those moments where we're really painful. But I want you to remember that gratitude is one of the fastest ways out of healing, out of pain and into healing. And so being able to look at your children, and in that moment, when you're a 15 out of 10 on a pain scale, you do whatever you can to get your butt on the floor and play a game with those kids. You do whatever you can to put on the best face that you can. Strap on, in my case, strap on a back brace and throw a bunch of essential oils on your body and take 2 Advil and go on date night. You just do it, and you don't make excuses. You force your way through it. You bite your tongue. You do whatever you have to do, but you enjoy family through that 15 out of 10 or 12 out of 10. And so that's my thought process, man. That's what I tell people. You do what you can do. You do it with a grateful heart, and you let people serve you, and you do your best to try to get out of that inner sort of dwelling that you get into with chronic pain.
Awesome. Completely awesome. I really thank you for what you shared, because, you know, as we go forward in this show now, this is where I'm going, is I'm talking to people who've lived it. Yeah. And it's these gems, like you've said about, I don't know, 10 different things in there that we could all take away and just do, and the quality of our life will get better. Because even though we got pain or had pain, that it's not about that, right? Yeah. It's just like, pain is not the problem. I say pain is a gift. Pain is a process that we must go through to go where we're going. Right. And the deeper meaning of pain is something I've been reflecting on a lot as well recently. And it's like the path of the soul as we move forward, you know, brings up these things called sciatica or migraines or sequestered discs, and you're on your back. Sucks. I love the name of your show, by the way. It's brilliant. Yeah. It sucks. It does suck. That's what it is. And thank you, Dr. Chris. I'll put a word out for Dr. Chris, the young head of neurosurgery. Suck it up, mate. Get on with it.
Yeah.
I think
he called me Buttercup. It made me mad. Yeah, like Buttercup. You just met me 2 minutes ago. I'm no Buttercup. I was a Buttercup, man, for sure.
Oh boy.
Yeah.
I'm sure that doesn't go down too well with a lot of people.
Yeah, he was right. But you know what? You tell it to him anyway. Listen, you bring me. Let me interrupt you for 1 second. Telling people the hard truth.
Yes.
And then is important when it comes to chronic. You can, and as physicians, we can do it with a wonderful bedside manner. Like you can look someone eye to eye, especially when you've walked their shoes, sit knee to knee, and you can coach them into why they have to change that process. Rubbing, doing a light massage and telling people what they really want to hear is not going to help a chronic pain patient. They need to hear the truth. They need the hard truth with a cheerleader attitude is what I try to do. Yes. That cheerleader, you can, with a positive exclamation mark, and you can do this, and stop that stinking thinking, right? Tony Robbins, high-fiving them. They don't want to do that stuff. But just as well as I do, when you look someone in the eye and tell them the hard truth with a great cheerleader, you can see their soul change behind their eyes, that hope that it gives them. And so, yeah, man, that's what he did for me that day. Suck it up, Buttercup. And I've learned that, when I'm sitting there with people wiggling and squealing and they, all over the place, and I just want to put my hands on their shoulders and say, I believe in you. And actually it's funny because my consultations, if you don't mind me saying this, I will look at people in the eye and say, I will help you and you will win, but you're going to have to be okay with hurting for the next 3 to 6 months. Now, it is not pain that is going to kill you, and it is not pain that means you're getting worse, but you have a massive trauma, and we're going to uncover the cause of all of it, and we're going to heal you. And we're going to get to the cause, and you're going to heal you. You're going to heal yourself. But the truth of it is, you're going to have to be okay with how you feel right now and learn to love it and own it, because that's your path out. And people don't like to hear that, but they understand. Like maybe a week later, they begin to understand as they start to see some brilliance occur in their life, that they're more powerful than any medicine or any scalpel or any oil. They're more powerful than anything man has ever created. And it just starts from the inside, but it takes harsh, sometimes very real words to give them the hope that they need. Because most of the time, as you and I both know, they've spent at least a month or two trying to do everything to avoid you and I, right? And everybody praying on them, putting hands on them, and doing all the things that are okay, but they've never really owned it themselves, and we need to get them to own where they're at right now.
Exactly. Yeah. And I love what you just said about, it's not about necessarily all the tools that we've got, all the modalities and the creams and the tablets and the manipulations, and it's not really about that. That's part of it, sure, we need it, absolutely, but we are the answer.
Yeah,
right. It's in us. We are the most powerful beings in the universe, I believe.
Yeah.
Right. And this brain of ours, and this heart of ours, is running the show. The electromagnetic connections, the physicality of it is just. Yeah. We are the answer, and I love what you just eyeball to eyeball with heart and compassion.
Yeah.
Get it, and they break through into the, oh my gosh, is this possible? Whoa.
Yeah.
And acceptance of what is.
Yeah. Sorry, must be a dog walking around out front. Sorry about that. And you know what, that's the worst time for him to do that, but you're absolutely right, because the truth of the matter is what we offer in terms of all of our modalities and therapies and healing is all great. I mean, to me, it's all necessary. But at the end of the day, it would mean that there's never been one person in the entire history of the planet with chronic pain that has ever been able to get better without us. And then we just know that's not true. There's somebody not listening to this podcast, has no access to information, sequestered a disc, and in 4 months, they're going to heal. Somebody somewhere is, which means the answer is inside. It's that connection to the healing that God gave us. That's the answer. And all we're doing is facilitating that. And by facilitating that, we might speed up the process a little bit. I think my other fear is by us facilitating things, sometimes we don't actually get people to the heart of the cause, right? I have wonderful people around me who I adore, who are massively into their therapies and the things they do for their clients, but I don't see life changing. And then people end up here, and it's like all of those expensive machines. I Twitter this all the time. Like, when you walk into a clinic, the likelihood of you getting better is based off the expense of the machines that they have. The more expensive machines they have, the less likely you are to get better. And what I mean by that isn't harsh. It's not, discounting those things. What I mean is that we tend to walk into places looking for some tool or machine or something plugged into a wall with a lot of fancy lights that's going to make us feel better, when all those things are okay. But like you said, our healing has already been placed in us, and our job right now is to bring it out. And those things can facilitate along the way. But at the end of the day, it's our truth inside of us that makes us better.
Profound. Absolutely profound. Yeah. Tell us about this book coming out.
Yeah, man. All right. So I've spent the last 4 years just working with people and just going through what I went through, but I've also learned from them. There's been things that worked on me that didn't work on them. And I'm talking about, therapies, natural healing, supplements, diets, whatever. And so what I started to do was realize, after working with dozens and dozens and dozens and dozens of people, this worked for some, this didn't, but everything worked at some point. Right. And again, we're not talking about that inner soul healing as much as we're talking about these therapy thingies. But so I decided that one of the things that was crazy is people are coming in, they're like, hey, do you have a resource for like where I can learn this? And then, yeah, YouTube. Yeah, Google, and so about a year ago, I decided that I was going to just compile everything I had learned into one location. This is not a book of science. There are no references in this thing. I just decided that I wanted to put something together that was like as simplistic as it could be, for the simplest way that people could just understand a little bit of what I went through and what I've been doing with people. And then here's just 97 things that you can do. And then the book then, expands to the website that we're doing, or the subscription service that we're about to launch and offer, where like what I wanted to do is just have one place where people could go. So the book is just a little bit of my story, but mostly what we've walked through with people in terms of what they can do on their own at home to handle two things: micromotion and inflammation. And handling those two things is the key to unlocking, the physical side of healing, and then putting together a place where people can get massive amounts of ways to handle those two things. And that's what the book is about. So hopefully it'll be out and ready next week. My plan is actually, I'd like to give it away for free, at least for a while, just because I know that people need it so badly. And then when the subscription site launches, then people will have access to even more stuff. But again, just a one-stop shop, a library of things that people in chronic pain don't have to spend time looking up. They can literally go there and see, and choose which ones work for them and try different things.
Awesome. Love it.
Yeah.
Love the subject of inflammation. Yeah.
Yeah.
Absolutely.
Yeah. That's the big one, right?
Yeah.
Well, and the truth is that, this is what I tell people all the time that walk in with pain. I'm like, your problem is not your elbow. It's not your back. It's not your knee. Your problem right now, your enemy is your inflammatory process. You're not in control of it. And then when we have a quick talk about acute versus chronic, which I think is so important, but what people just have to understand from the physical side of things is that the body never makes a mistake. It's never wrong. It's always only ever doing what you're asking it to do. And it's only responding to the commands that you give it. And so that's the problem. So when someone walks in and they're in this place of life where their constant subconscious command is inflame, 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 inflame. And here you and I are with our special talents wanting to get below that inflammation to begin to handle some processes to help turn off the pain, but they're in constant command mode of inflammation. We got to turn that off. And so one of the very first things that I work with people the first few weeks is like handling that level of inflammation, whether it's through medical medicine, or whether it's through over the counter, or if they're in a place where they can handle some natural things depending on their tolerance levels, and are they sleeping or not, which I think is, more important than anything. Sleep is so important. So people are like, well, I don't want to take a heavy med. I'm like, whatever you need to do to sleep right now, don't argue with me, so just get some sleep right now. But inflammation is everything. That's the enemy. We can attack the other things, but we've got to get that enemy out of the way first, right? And then, of course, we have the emotional side of inflammation, but yeah, inflammation is everything. So we're going to handle that first. And that's what the book and the subscription site is going to be about, just, massive ways to handle that inflammatory process.
Well, I look forward to reading that book and using it.
I'll email it to you.
Yeah,
so you can look it over. Yeah.
Yeah, it's great. And Micromotion, I love that subject too. I've been focusing this a lot myself in the last couple of years, and learning about somatics and body awareness, and really connecting with movement. And hey, I'm no specialist or therapist, I'm not trained in this domain, but as an athlete for many years, and just working through things myself for 30 years, 40 years even. The decades are rolling on.
That decade went away on you pretty quick, Dr. Wayne. All right.
We need this connection. We say that nothing more powerful in the universe than our bodies, and I just find it connected from the head to the body, right? Connect, and we need to know how to move.
Right.
Think about how many movements we make. It's absolutely ridiculous. There must be billions of different movements all the time.
Right.
Like, whoa. So tell us a little bit your take on micro movement.
Yeah. So I started understanding this probably when I was getting care. When you have a back issue and your back hurts and you're a chiropractor, one of the things that you want someone to do is put me on my side and just manipulate that, just adjust that thing, just pop that thing wide open. And I can remember laying on my stomach in the back of our SUV with my left knee up by my ear almost, because that was the only thing that I could tolerate as my wife drove me to my friend. And that son of a gun would do anything I wanted him to do. He took these tiny little instruments and just started making these little tiny movements along my spine. And that pissed me off at the time. But as I look back, I realized what he was doing. And then I started looking into it as I was working with more people. And I don't know if the term, I just call it micromotion, but here's what I mean by that. Most of us have lost those little small movements of the joints of our body as we get older, through trauma, through life, through gravity, through misalignment, whatever it is. When it comes to the spine, one of the things that people are forgetting is that, yes, I can bend my neck and look down at my toes right now. And that, even with me right now, is full. I have a full range of motion. The question is my C7 vertebra working together with my C6 vertebra working together with my C5? And are those micro connections between 7 and 6, 6 and 5? Are they working correctly? My whole neck is bending forward, but am I taking my beat up, nasty, arthritic, disc dehydrated neck and just bending it forward? Or are all of the joints working together individually the way God intended within the bigger picture of the whole thing working together? And what I call that is micromotion. And so people, especially with back problems and disc issues, they've lost that. And unfortunately, therapy, especially physical therapy, most chiropractic, getting to the personal trainer, everybody's aware we want to get motion, we want to get motion, we want to get motion. I get it. But what we're ignoring are those micro motions. We're ignoring through our exercise habits that one vertebra needs to work correctly on the vertebra above and the vertebra below before we can get the entire thing in a bridge, in a McKenzie exercise or an extension exercise, that we're ignoring those things. And I hate to toot my own horn or want to brag on certain things, But I think the separation of when people come to see me, I spend those first couple of weeks with tiny little instruments, just getting those reset. Then all of a sudden we're springboarding into this massive, awesome ability to begin to move again, where then we can take an advantage of all of the wonderful therapies out there, from chiropractic to physical therapy to hiring personal trainers, all the things to restore our core and get our emotion right. And if you think about this, I ask people all the time, hey, when you're going to change a lane in the car and you're driving, and maybe this is us old school guys, Dr. Wayne, you and I, where we would turn our head to look because we didn't have the mirrors and the signals, right? But you go to turn your head and you go to look, and you realize, my God, I turned my neck, but I got to like turn my body now. I'm in my 40s to look and see. You know what I mean? My neck should go further than that. Listen, that's a sign the micromotion's gone. Hey, I can turn my head, but it's not actually moving the way it was intended to. And I ask people like that all the time when they come in with disc injuries, whether it's neck or, I'm like, hey, do you ever realize, oh yeah, no, I haven't been able to really touch my toes. Well, you lost your motion. Nothing just happened for a reason. It just wasn't like this freak thing. It was happening over time. And so restoring micromotion and handling inflammation, to me, are the two pillars that create the foundation to allow this, like you said, most amazing thing in the whole universe, our body, to reconnect with the spirit, to allow that healing to flow through the physical so that we can have it. And I think we ignore that. We're so into fixing the pain, we forget the foundation. That's my micromotion.
Love it. Wonderful. I haven't quite heard it as clear as that. And we haven't talked about that in the show yet. So thank you so much for bringing that up.
Yeah.
And I really look forward to your information. So everybody, get a hold of Matthew's book. What's the title?
It's just called Pain Sucks.
Of course.
No one gets to tell you that you can't heal. Yeah. Pain sucks, man. We're going to keep it simple.
From podcasts, and check out his podcast. Is it painsucks.com or Pain Sucks? Just Google.
Just it's on iTunes right now only, just Pain Sucks podcast. Yeah. And then, Pain Sucks podcast is Facebook and Instagram and Twitter. Yeah. And then Pain Sucks on Patreon is what we're using for our subscription. So that's up now. That's ready to go now. It's just most of the content hasn't been uploaded yet. So it'll be any day now. Same with the book. So yeah, just Pain Sucks. And it'll be on Kindle Prime, and it'll be we're going to host it on PayHip as well, so people can find that. So yeah, it's all kind of happening so fast. I'm trying to website this and website, just trying to put it all together, but I appreciate the shout out. That's great.
Well, listen, congratulations.
Thanks, man.
The biggest congratulations is how you've taken the mind and the spirit and the body. And that's your message. It's not, as you say, about what you do in the office. It's everything. And we are everything. And, for everybody listening today, just remember that. And maybe start asking yourself questions. What do I need to do next? What book do I need to read? Which podcast show do I need to listen to? What YouTube video do I need? Just ask the question and go with the flow.
Right.
I believe, as you found, that we do find our way, and there are answers and there are solutions.
Yeah.
And it's way bigger than we'll ever know, but they're there and we just find them. So,
yeah. The healing is already been placed in us, right? I mean, you know that, I know that. And I think innately everybody knows that, right? We know that a paper cut heals. So why is this not healing? And I think innately we just have to begin to uncover the layers of our life that have put the things in front of that process. And I love that your first question today was about the emotional state of things, and because it's totally true, and it's refreshing to have that conversation. So thank you for having me. It's been awesome, man. And for those of you listening too, I just met Dr. Wayne. I'm already super impressed. His podcast is excellent, but he told me today he's speaking at one of the greatest and the largest conferences in the world on chronic pain. So I'm being interviewed by one of the best 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 in the world people and that's awesome. So as you're laying there and you're like, what's my life going to add up to? Listen, 5.5 years ago, I never would have laid in bed thinking that I'd get to talk to someone like you. So about what I went through and how we're helping people. So I appreciate you so much. And thanks for having me today.
It's been a privilege and an honor. So listen, let's keep in touch. It's great to
Okay.
meet you as well, and all the very best.
Thanks, man. Have a wonderful day.